Bismillah ar-Rahman ar-Rahim. Hello, my friends, and hello, my fans, hello, my colleagues, hello for everybody, everywhere, in any place who follow my clinical topics presentations online. Today, I will talk about an important issue, which is the heart in systemic disease. How is the heart involved and is affected by diseases elsewhere in the body, in other organs, or in other systems of the body, or in systemic disorders, or in multisystemic disease? I will divide my presentation into three parts. What are the mechanisms of cardiac involvement? That is the pathobiology of cardiac complications in systemic disease, the mechanisms, and then I will talk about the different cardiac syndromes or cardiac manifestations, that is the manifestations of cardiac involvement in systemic disease, and then I will talk about the causes of cardiac disease in extracardiac problems or extracardiac pathology. First, to talk about the mechanisms, how is the heart is involved? As I mentioned before, the organs of the body and the different systems of the human body, they are always in reaction or interact together in health and in disease. That is under normal physiologic conditions and in non-physiologic conditions, especially in pathological states or when the body is affected by disease. The mechanisms of cardiac involvement, how is the heart is involved and is affected in other systemic disease. As I mentioned before, the heart might be affected, or the cardiac manifestations may be due to an intrinsic heart disease, that is heart disease arising in the heart is what we call intrinsic or primary cardiac disease, like for example coronary artery disease, or primary cardiomyopathy, or primary valvular heart disease, whether it is rheumatic heart or congenital heart, or in primary pericardial disease. These are primary disease which start in the heart, but my topic is related to how is the heart affected secondarily, or what we call a secondary heart disease, or what we call extrinsic heart disease due to extrinsic pathology, or the heart as a part of or as a complication of other organ or system pathological affection. And these pathology secondary affect the heart. So the mechanisms involved is one of the following. Either number one, what we call increased metabolic demands on the heart, a disease which causes increased metabolic demands on the heart, so it will cause cardiac manifestations or cardiac pathology. This is the first mechanism. Second mechanism is through what we call electrolyte or metabolic disturbances, which cause arrhythmias, and the arrhythmias will cause a cardiac dysfunction and cardiac manifestations. So number two is through electrolyte and metabolic disturbances. Any disease in the body, when causing electrolyte or metabolic disturbances, they might affect the heart indirectly through these metabolic and electrolyte derangements. For example, in patients with hyponatremia or hypokalemia or hyperkalemia or calcium homeostasis disorders, hypocalcemia and hypercalcemia, we know that these electrolyte disturbances, especially those affecting the potassium and the calcium, they might affect the heart. So the mechanism of cardiac dysfunction of some diseases is through producing electrolyte and metabolic disturbances, or acid-based disorders. As we all know, metabolic acidosis or acidosis in general, they might affect the heart in a negative way, because acidosis affect the cardiac properties, especially the inotropic and chronotropic properties of the heart, which are normal physiologic properties of the heart. We call them the cardiac properties. So the metabolic, acid-base, and electrolyte disturbances complicating other disease in the body As, for example, what happens in patients with organ failure, in liver cell failure, in uremic failure, in respiratory failure, there is electrolyte disturbances, acid-base disturbances, there is hypoxia, there is hypercapnia. All these metabolic and electrolyte and acid-base disturbances, they might affect the heart negatively, producing cardiac dysfunctions and the cardiac manifestations. So through producing this second mechanism, producing electrolyte and the metabolic disturbance, which might induce arrhythmias, and the arrhythmias will cause cardiac dysfunction. Another mechanism is through structural involvement of the heart itself. That is, there is anatomic involvement of the heart by the disease. And this might either involve the cardiac muscle producing cardiomyopathy, or they might involve the pericardium, or might involve the endocardium, especially the valves, because as we know, the cardiac valves is part of the endocardium. So the structural changes in the heart, which is the third mechanism of cardiac involvement in systemic disease, is through affection of the different layers of the heart, whether the endocardium, the myocardium, or the pericardium. So this is the third mechanism. Another mechanism is through affection of the vascular supply of the heart, that is the cardiovascular complications by predisposing to atherosclerosis of the arterial blood supply of the heart, which is the coronary circulation or the coronary arteries, so through coronary artery involvement. These are the main mechanisms of the cardiac involvement, altering the structure or the function of the heart, or both together. That is the structure and function of the heart. So there will be cardiac manifestations due to pathologic involvement and or functional affection of the heart, or functional disturbance of the cardiac muscle and the other layers of the heart. So these are the main mechanisms of cardiac manifestations, either increased metabolic demands of the heart, either through metabolic and electrolyte and acid-base disturbances, which affect the function of the heart, producing most commonly arrhythmias, which might precipitate cardiac dysfunction and the heart failure, or through structural involvement of the heart by a disease, which directly affect the structure and involve the cardiac muscle structurally, or other layers of the heart, as I mentioned, might involve the pericardium or the endocardium, or through cardiovascular affection by affecting the arterial supply or the vascular supply of the heart, the large vessels or the small vessels of the heart, and so there will be disturbance in cardiac function at the end. So through structural or functional changes, or both together. This is the mechanisms. Then we come to the presentations. How does these systemic diseases through these mechanisms will manifest? They either manifest, the commonest is to manifest with heart failure. So they might present with cardiac dysfunction and frank clinical failure, whether biventricular or left ventricular or right ventricular, or congestive heart failure, biventricular failure. Another presentation is by cardiomyopathy. Another presentation, third presentation by arrhythmias. A fourth presentation by hypertension, and the hypertension then systemic hypertension will affect the heart, or through pulmonary hypertension, and the pulmonary hypertension will affect the right ventricle and the right side of the heart and cause cor pulmonale. Or it might present also with a pericardial disease. So cardiomyopathy, heart failure, arrhythmias, cardiac failure, hypertension, these are all, and of course, through, as I mentioned, because of cardiovascular, they might present with a coronary ischemic syndromes, that is unstable angina, or acute MI, that is the acute coronary syndrome. So these are the main groups of cardiac manifestations due to systemic disease, mainly cardiac failure, MI or coronary syndrome, arrhythmia, myopathy, endocardial disease. These are all manifestations of cardiac involvement in systemic disease. Then I will talk about what are the possible causes of, or the classification of diseases, or the diseases which might involve the heart. What are these systemic and organ system diseases? Let us speak about number one. The first group is the group of the metabolic or organ failure causing metabolic disturbances, and this through these toxic metabolites and the electrolyte disturbances and the changes in the acid-base balance, they will affect the heart indirectly, as I mentioned before. This is like as exemplified by, of course, the major organ failure in liver cell failure, whether acute or chronic failure, also renal failure, whether acute renal failure or chronic renal failure, and the uremic syndrome. Or patients also with respiratory failure, hypoxic respiratory failure, pulmonary failure. So this is the major organ failure: pulmonary failure, liver failure, kidney failure. This can affect the heart through metabolic and changes in acid base and changes in electrolytes. This is as regards the first group of causes, so organ damage or organ failure, as I mentioned. Number two is the group of endocrine and metabolic disorders which might involve the heart or affect the heart. This as happens in patients with thyroid disease, thyrotoxicosis and hypothyroidism, functional disturbance of the thyroid. They, of course, have complications. We have thyrotoxic heart disease, cardiomyopathy, heart failure, arrhythmias. The commonest is atrial fibrillation due to the high levels of thyroid hormones in thyrotoxicosis of whatever etiology, whether in Graves' disease or in toxic nodules, or whatever the cause of hyperthyroidism. So in hyperthyroidism, thyrotoxicosis, we get thyrotoxic heart disease with a wide range of manifestations and complications, including heart failure, myopathy, heart failure, arrhythmias, and the most common, of course, is atrial fibrillation as a complication, cardiac complication of thyrotoxicosis, uncontrolled hyperthyroidism. So thyrotoxicosis. Hypothyroidism can affect the heart also. Myxedema. This is what we call myxedema heart disease, with cardiomyopathy, of course, and with the common pericarditis and pericardial effusion complicating myxedema. So through pericardial disease and through myocardial disease, or through the hyperlipidemia associated with hypothyroidism, it might affect also the cardiac circulation, that is the coronary circulation, and it can predispose the patient to ischemic heart disease. So hypothyroidism can predispose to ischemic heart disease, to cardiomyopathy, to pericardial disease, with all the complications of pericardial disease up to cardiac tamponade if there is massive pericardial effusion in severely uncontrolled thyroid failure or advanced myxedema, which is not treated or incompletely treated. So this is the range of heart disease in hypothyroidism, or especially in advanced states of myxedema heart disease. Also in patients with toxic nodules, as I mentioned, thyroid nodules, and they might present with AF. In patients with thyroid cancer, that might affect the heart through metastasis or through paraneoplastic, non-metastatic manifestations. And we all know that the paraneoplastic manifestations, they are a group of disorders triggered by altered immune system response to the neoplasm, altered immune system response to the neoplasm, or related to inflammatory cytokines, or related to other unknown metabolites. They affect the heart, and the affection might be a form of what we call a non-metastatic paraneoplastic cardiac disease. So this is part of the cardiac involvement, might be one of the categories of paraneoplastic presentation of thyroid cancer, or of other cancers, like what happens in lung cancer or in other body cancers. So thyroid cancer can also affect the heart. So this is the whole range of also in patients with autoimmune thyroid disease and Hashimoto's thyroiditis and Graves' disease. So whether the thyroid is affected pathologically, functionally, by the wide range of pathologies which involve the thyroid or the functional disturbance which affect the thyroid, whether towards the thyrotoxic end or towards the hypothyroid, and in all cases of this thyroid dysfunction and thyroid pathology, there might be cardiac disease associated with thyroid pathology and thyroid dysfunction. So this is another category. In patients with adrenal disease, and in patients with Cushing, this is related to adrenal disorders. So Cushing can affect the heart with cardiomyopathy. Cushing can also cause diabetes and cause hypertension, and through the diabetes and the hypertension, it affects the heart indirectly. So Cushing disease, which is related to either adrenal problem or to pituitary problem. Patients with Addison's disease, they might also get cardiac complications through electrolytes disturbances, and also and of course through other mechanisms, the uremia or the high uric acid, the recurrent hypotension associated Addison can affect the heart also, which is a state of chronic hypoadrenalism. Patients with acromegaly due to an adenoma of or growth hormone secreting pituitary adenoma. So this is a pituitary disease related to excess growth hormone, which also can affect the heart by causing cardiomyopathy, by causing arrhythmias, by causing cardiac hypertrophy and heart failure, through producing the hypertension, and then there will be hypertensive heart disease. So acromegaly can affect the heart directly and indirectly, producing cardiac manifestations, especially myopathy and cardiac hypertrophy and cardiac failure, and even also sometimes coronary heart disease. So this is the range of cardiac complications of acromegaly. In patients with pheochromocytoma, which is an adrenal medullary tumor, also there may be a wide range of cardiac complications. The hypertension associated with pheochromocytoma that affects the heart, arrhythmias, and recurrent tachycardias, which might involve the heart. The pheochromocytoma itself, through excess catecholamines, can produce some form of cardiomyopathy, which is dilated cardiomyopathy. So the dilated cardiomyopathy or the congestive cardiomyopathy due to excess catecholamines itself. So the pheochromocytoma, through different mechanisms, through the hypertension, through the arrhythmias, through the catecholamines, it involves the heart producing arrhythmias and the cardiac failure, pheochromocytoma. The Anderson-Fabry disease, it's another metabolic disease which present with cardiac arrhythmias and heart failure and cardiomyopathy. Also, patients with hemochromatosis, it can produce some form of dilated cardiomyopathy, so or arrhythmias or heart failure. So this is the range of cardiac complications with hemochromatosis, which is a metabolic disease related to iron metabolism. Amyloidosis is another storage disease which is associated with also restrictive cardiomyopathy. And of course with sometimes pericardial disease, the amyloidosis. So these are different metabolic diseases which and endocrine diseases, and of course the commonest of all is the diabetes and the diabetic heart disease due to macrovascular complications related to the diabetes as a predisposing factor to coronary artery disease, or through microvascular disease producing what we call diabetic cardiomyopathy. So diabetes, which is the commonest endocrine and metabolic disease, also it affects the heart, of course, as not to forget the diabetes or the diabetic syndrome. These are all endocrine and metabolic diseases which might involve the heart. Then we come to another group of diseases, which is the cardiac involvement in multisystemic disease, and especially in patients with autoimmune multisystemic diseases, like involvement of the heart in patients with Sjogren's syndrome, in patients with rheumatoid by pericardial effusion. In patients with systemic lupus, lupus can affect the heart, causing myocarditis, causing autoimmune, of course, causing pericarditis, and this is very common complication of, or causing Lippmann-Sachs endocarditis, which is a type of endocarditis aseptic associated with systemic lupus. So lupus can involve the endocardium with Lippmann-Sachs endocarditis, can involve the myocardium with myocarditis, and then cardiomyopathy in chronic cases, or can involve the pericardium by an immune-mediated pericarditis. So these are the range. So lupus, systemic lupus, can affect all the layers of the heart, producing different cardiac complications. So a systemic lupus as an example of collagen vascular autoimmune disease, which is organ non-specific. Patients with mixed connective tissue disease also, patients with scleroderma, they can present with cardiac complications. Patients with polyarteritis nodosa, through affection of the pulmonary vasculature, it can affect the right side of the heart. Also, sometimes the left side of the heart is involved in patients with polyarteritis nodosa. Patients with mixed connective tissue, as I mentioned, patients with connective tissue overlap syndrome can be in the heart, can be affected. Patients with sarcoidosis, they also another multisystemic disease of unknown etiology in which some authorities claim an abnormal immune response to a trigger, most commonly infection or toxin or a chemical, which produces a sort of what we call inflammation or systemic inflammation with inflammatory aggregates forming what we call, or aggregation of inflammatory cells forming granulomas. That's why sarcoidosis, it is a granuloma, non-caseating granulomatous disease. This is the basic pathological feature of sarcoid, is a non-caseating granuloma due to accumulation of inflammatory cells in aggregates, which we call them granulomas. So these granulomas will form in any tissue, including also the heart. So involvement of the heart by sarcoidosis through producing congestive cardiomyopathy, sometimes restrictive cardiomyopathy in sarcoidosis also, arrhythmias, heart failure, sarcoid nodules in the myocardial muscles causing cardiomyopathy, as I mentioned, or maybe in the pericardium causing a sort of restrictive heart disease. So the range of the sarcoid heart disease is wide, or rarely through sarcoid vasculitis. And especially if there is what we call pulmonary granulomatous angiitis as a complication, although it is rare, but it might happen as a complication of sarcoidosis. And the vasculitis associated with sarcoidosis can affect any vessel site, from large vessels to small vessels. So sarcoid can also affect through the heart through angiitis, either by involving the coronary arteries or through involvement of the pulmonary arteries, causing what we call a sarcoid granulomatous and pulmonary granulomatous angiitis, which can produce hypertension and affect the right side of the heart. So there are different levels of involvement of the cardiopulmonary circuit in patients with sarcoidosis, especially in the classic cases of sarcoidosis affecting the lung, the pulmonary sarcoidosis, because you all know that sarcoidosis is a systemic disease, but most commonly start in the lung and lymph nodes, causing hilar lymphadenopathy, mediastinal lymphadenopathy, lung involvement, granulomatous affection of the lung, and then it might involve other organs, including the skin, including the nervous system. And yesterday I talked about neurosarcoidosis, sarcoid affecting the CNS. Today I am speaking about the cardiac sarcoid, that is sarcoidosis affection or cardiac involvement in sarcoidosis as a multisystemic inflammatory, probably immune-mediated disease. And of course, we all know that it is immune sensitization to a trigger in a genetically predisposed patient. In many cases of sarcoid, there is a genetic predisposition also, hereditary plus immune due to triggering factors. So the predisposing and precipitating causes of sarcoidosis, a possible relation of sarcoidosis to many genetic and acquired factors in which the immune system is involved in producing these systemic inflammatory manifestations of sarcoidosis. The heart is part of this systemic involvement in sarcoid disease. So this is another autoimmune systemic disease which might involve the heart, also in hyperhomocystinemia through producing atherosclerosis and other manifestations. The heart is involved. So these are the how is the heart is involved in multisystemic disease. Also in vasculitic syndrome, especially all systemic vasculitis might involve Takayasu disease, might present with coronary artery disease, especially in children. This is a form of large vessel vasculitis. So Takayasu syndrome is there is of course classic large vessel vasculitis affecting the heart, and it most commonly present in young adulthood and in children with coronary attacks due to large vessel vasculitis affecting the Takayasu. It is another vasculitis, large vessel affecting the in which the heart is involved early in life. So all vasculitic syndromes, large vessel and small vessel, they can involve the heart with large vessel vasculitis or small vessel and medium-sized vessel vasculitic syndromes. The heart can be involved. So this is another autoimmune systemic disease group which can involve the heart also. Then we come to the third group after the metabolic, the fourth group after I mentioned the metabolic and the electrolyte, and then I mentioned the endocrine and metabolic, and then I mentioned the autoimmune and multisystemic diseases with all its examples. Then I come to the last thing, the involvement of the heart, another group, the fourth group, which is involvement of the heart in infections. The heart can be involved in many infections, whether acute infections and chronic infections. The most common, of course, is I'm speaking about systemic infections which involve the heart, not speaking about the primary. There are primary infections which directly involve the heart, like viral myocarditis, Coxsackie or echoviruses with primary myocarditis. But there are other systemic infections which can directly and indirectly cause cardiac problems. Like the most common example of acute fevers and acute infections is typhoid. Salmonella infections, they can cause toxic myocarditis as a complication. So be careful. Meningitis can also affect the heart. This is also meningococcal meningitis is an acute infection involving primarily the brain, but it can also have some form of toxic myocarditis. Also, toxic myocarditis complicating pneumonias, and here the infection didn't start in the heart; it is in the lung. So pneumonias can be complicated, especially whether the typical pneumonias or the atypical pneumonias like Legionnaires' disease, they can be complicated by toxic myocarditis, and they might present with arrhythmias due to toxic myocarditis. So arrhythmias can be a result of the cardiac problem or of the cardiac dysfunction, or they can be the presentation of the cardiac disease. So arrhythmia as a presentation of cardiac involvement in systemic disease may be a cause or may be a result. Here, for example, in toxic myocarditis, the arrhythmia might be present. AF can complicate pneumonia, whether community-acquired pneumonias or hospital-acquired pneumonias. So be careful that this is what we call extrapulmonary complications of pneumonias. One of the extrapulmonary, the nearest to the lungs, is the heart. So the heart might get complicated by toxic myocarditis and arrhythmias. AF is very common as a complication of the pneumonias, especially severe pneumonias, acute pneumonias. Also, in some other chronic infections, tuberculosis can involve the heart by tuberculous pericarditis. Of course, we all know, or by tuberculoma in the myocardium, which is rare, but it might happen. So tuberculosis can affect the heart, or indirectly through affection of the lung, producing pulmonary fibrosis, effusions, and then the heart will be affected by cor pulmonale. And cardiac failure complicating advanced pulmonary tuberculosis. So tuberculosis can involve the heart directly or indirectly. This is an example of chronic infection. Also involvement of the heart in other infections like patients with brucellosis, they might get. Patients with mononucleosis syndromes, there might be viral myocarditis, or the heart might be involved indirectly in patients with viral infections. Patients with viral hepatitis, they might get some form of pericarditis or myocarditis in some reported cases. So this is cardiac involvement in viral hepatitis. So hepatitis virus can also affect the heart. The mononucleosis syndromes, the other hemorrhagic viral fevers, they can involve the heart and affect the heart. Involvement of the heart in chronic parasitic disease disease, like in patients with malaria and like in patients with trypanosomiasis. We have trypanosoma heart disease. We have leishmania in visceral leishmaniasis, Kala-Azar heart disease. So these are all wide range of chronic infections which might involve the heart, and this we can have a special presentation about infections, systemic infections and the heart. And then we come to also HIV. It can affect the heart by cardiomyopathy, by arrhythmias, by heart failure, by effusion in the pericardium. So HIV, before we forget, also an example of, it's a common disease, the HIV. One among the spectrum of HIV-related clinical syndrome is cardiac disease in HIV patients. Especially in AIDS patients and the pre-AIDS syndrome. So heart disease in which is HIV-related cardiac disease in HIV patients. Also in tumors, neoplastic disease and the heart. This is also another group, important group, neoplastic causes of the heart. And I mentioned among the cardiac involvement in solid cancers due to lung cancer, due to breast cancer, due to thyroid cancer, due to gastrointestinal cancer, mainly through paraneoplastic manifestations related to immune dysfunction and the effect of this immune dysfunction or immune-mediated mechanisms related to release of some white B cells, especially the T cells, and also related to antibodies, or related to inflammatory cytokines, or related to unidentified metabolites. These are all can affect the heart and cause the cardiac complications. This is the cardiac manifestations of cancer as a part of paraneoplastic syndromes. This we call it paraneoplastic cardiac complications of an underlying malignancy. And I give examples of these cardiac complications, metastatic, non-metastatic cardiac complications of lung cancer, non-metastatic cardiac complications of breast cancer, non-metastatic cardiac complications of thyroid cancer, non-metastatic cardiac complications of hepatocellular carcinoma, non-metastatic cardiac manifestations of hypernephroma, this renal carcinoma. So the cancer mainly causes cardiac manifestations through non-metastatic mechanisms, but also rarely through metastasis. If there is metastasis to the heart, which is rare, if the heart is a rare site of metastasis, by the way, not like the lungs, the liver, and the brain, and the bones. These are the common sites of but the heart can be also a site of distant metastasis. But more commonly, the cardiac involvement is through non-metastatic mechanisms, that is immune-mediated cytokines or abnormal metabolites secreted by the tumor which affect the heart. This is non-metastatic cardiac manifestations of an underlying malignancy. Also, involvement of the heart in leukemias. If we come to hematological malignancies, involvement of the heart in malignancies, hematological malignancies, in leukemias, in lymphomas, there are different cardiac manifestations, especially cardiomyopathy, especially involvement of the pericardium, bleeding into the, sometimes bleeding, if there is bleeding tendency, they might get what we call hemopericardium, complicating hematological malignancy, or in patients with bleeding disorders related to coagulation abnormalities or platelet abnormalities, they might get bleeding inside the pericardium and the hemopericardium. So bleeding disorders. Anemia as a group descriptive of blood diseases. Any anemia can present with heart failure. Anemia can be a precipitating factor rather than a cause. It precipitates cardiac failure, especially severe anemia in which hemoglobin is less than 5 grams per deciliter. This might precipitate heart failure in a predisposed heart. Also, certain types of anemias, they involve the heart directly, like sickle cell, especially sickle cell occlusive disease. They involve the heart through small vessel. So sickle cell and other abnormal hemoglobins might be associated with special categories of cardiomyopathy or coronary microvascular disease, and this will cause heart failure. So affection of the coronary circulation of the myocardium in patients with abnormal hemoglobins and sickle cell disease. So these are also special anemias associated with direct structural cardiac disease. But any anemia in general if very severe, even nutritional anemias, iron deficiency, B12 deficiency, folate, or hemorrhagic anemias, if the hemoglobin fall below 5, the heart failure can be precipitated. So it is a common precipitating factor of heart failure in predisposed patients, especially patients with underlying or primary cardiac disease like a valvular heart disease, mitral stenosis, whatever valvular heart disease, or myocardial disease. Anemia is a common precipitating factor. So anemia can be a cause of heart problem. Anemia can be a result of also of chronic heart disease, what we call anemia of chronic disease. So the heart can be one of the causes, especially in patients with chronic heart disease, due to anorexia and recurrent vomiting, due to congestive manifestations, the congestion of the gut. There is commonly anorexia, there is commonly nausea, vomiting in patients with congestive heart failure, and this might predispose them to anemia. So anemia may be a cause or may be a result in patients, in cardiac patients. So this is the relation of anemia and the cardiac disease. So now I talked about the hematological diseases also as a probable cause of cardiac involvement in patients with systemic. So all categories of systemic diseases, endocrine, metabolic, autoimmune, multisystemic infections, neoplastic, hematological, organ failure group, these are all categories of systemic diseases. I summarize them, which involve the heart producing cardiac manifestations. So this is the heart in systemic disease. Thank you so much, and wish for all of you a safe and peaceful day, and bless all of you. God bless all of you. Thank you so much.